Good morning, Gokan. 7:34. Happy Wednesday to you. You know, the fleas and ticks around here know no days of the week. It doesn't matter if it's Wednesday, if it's Tuesday, if it's Sunday. Your pet might get a flea or tick. Your human might get a flea or tick as well. But Dr. Andrew Pierce, he doesn't operate on humans. He only operates on the animals.
Right.
Dry Pond Animal Hospital, drypondanimal.com, located in Denver. What a facility it is. And it's not just a hospital. It's not just an elite surgical wing. You've also got pet resort and boarding and all these fun things, and really almost like a holistic approach to taking care of your pets. Dr. Andrew, how you doing?
I'm doing fantastic. Thanks for having me, guys.
Thanks for coming back. I'm trying to ask, like, I'm sure there's some HIPAA rules or something with animals too.
Animals have to sign it. Yeah.
Any cool surgeries recently on animals? Like anything kind of wild that you've done since we've seen you last?
I mean, nothing too very crazy. I've had a couple foreign body things I've taken out.
We might have different definitions of crazy too.
Yeah, right.
So.
Yeah, that's true. But yeah, we've had a couple of foreign bodies where dogs have eaten things they're not supposed to and taken out a sock or a piece of underwear or something along those lines.
Always an adventure,
Yeah.
no doubt about that. If you've lived here long enough and you've gone outside during the summer, there's a couple of things that you've probably realized. One, it's humid here in this area. Two, we have quite a few little critter insect things that can kind of take over your world, whether that's mosquitoes for you as a human, but fleas and ticks are like a serious thing. And that's been around for a while for dogs. You were telling us about this new kind of innovation going on with flea and tick treatment for dogs. Is it just dogs, or do other animals get flea and tick treatment too?
Yeah.
Rabbits
definitely.
and everything else too?
Yeah, I even recently learned ticks or will get on snakes in the wild.
really?
Yeah. It's like one of the more common things that they'll get on. It's the craziest idea.
Wow.
But yeah, as far as the new innovation goes, company named Elanco came out with a new product called Prevecto Quantum. And what is it? It's an injectable flea and tick. So one injection would give your pet, your dog, 12 months of flea and tick preventative. And so if someone were to pair that with the injectable ProHeart, it's something that has the potential to be quite revolutionary in vet med, where you're not having to fight your dog to give this flea, tick, intestinal parasite, heartworm preventative every month. But at your annual visit here at Dry Pond Animal Hospital, we could just give your dog a single injection with the vaccine that would be due, with an exam, and you're good for flea and ticks. One more single injection for ProHeart, and your dog's good for heartworm, intestinal parasite preventative for 12 months. So
That's a game changer for families who are busy, who have to remember like all the other things, your children, your job, the house. And then you're like, oh, I got to get the dog their heartworm medication. It's not like the dog's going to pop up and be like, Mom, you forgot.
Exactly.
So I remember. So I haven't had a dog for a couple of years. So the way I remember it for the heartworm medicine is like the chew tablets or whatever that you do once a month, and then the flea and tick is like the liquid down the back that kind of gives the oil everywhere.
Yeah.
That doesn't have to be the case anymore.
Exactly. If you're listening and you're still using topicals, it's worth mentioning that there's a lot of resistance, especially with fleas, to topical treatments in dogs and cats in this area. But yeah, so we've moved to oral flea and tick preventatives. There's a couple different products that have it mixed in with the heartworm medication. But if you're like me, 5 kids at home, running businesses and trying to, have so much going on, I try to do it on the first of every month, but trails off. Next thing you know, it's the 10th and you've missed a couple of days. And but yeah, so this injectable is something I'm going to be moving my 3 dogs to, and just know they're going to be protected for 12 months. It's that easy.
As far as the price point, is it
Pretty
vastly
darn
different, or
close.
it's pretty close?
Pretty darn close.
Yeah.
And it's going to depend on, so every practice is going to be able to set whether a price point is. But yeah, pretty darn close as far as what you'd be paying for 12 months of flea and tick preventative for most practices. At least that's where we've landed, a little bit on the lower side of that, just to encourage folks to be able to get it.
You mentioned the concept of bringing your pet in for their annual. I'm not going to tell you last time I took my cat to the vet.
That's okay.
It's different. But for the concept of memorizing that or trying to remember, you guys do that work then, right? Because it becomes, okay, I'm going in for my annual. You document in the chart, hey, we gave it to him last year. Are we doing it again this year?
Bingo.
I imagine you make it even easier for people then too. I don't even have to remember. I just get the text message reminder probably that it's time for another appointment if I had to guess.
Yeah, exactly. And it's taken us a little while to build that part out of Dry Pond Animal Hospital and Pet Resort. But yeah, we do have the text messaging reminders for things that are coming up for your pet once they're plugged in with us through a platform called Pet Desk. You can actually message us directly through that app. You can go on our website and plug right in and use that same app to reach in and make an appointment same day. And so if you went to our website, that'd be something you could do really at any time, whether you're already plugged in with Dry Pond Animal Hospital and Pet Resort, or it's something that you're looking to do. You can create your little profile right there and ask to be reached out to.
I love the idea of the hospital and the pet resort being in the same spot, because if my pets are ever like my children, where they just jump off the top of the couch to like wonton suplex each other, then I'm at least knowing that while my pet is staying at a wonderful pet resort, they could get the help they need if they were to get injured or hurt or anything like that. I imagine you guys have all the things there that you need. What's the pet resort like these days? It's summertime, that must have been wide open for
Dogs
you,
all
I
in
would
the pool.
imagine.
Yes, yeah,
Lounging.
lots of pool runs. I mean, like you said right off the bat, like it has been sticky hot, humid. So there's been extra breaks. If you bring your pet there, you've probably noticed more inside. It seems like the last couple of weeks than usual. And then we hit that I swear it rained for like 14 days in a row.
Felt like it did.
But yeah, I mean, it's been a fantastic summer. A lot of great things going on there for us. Some new staff. We had some really fantastic college students that came through that
Very
really
cool.
leaned in. Some folks that are interested in vet med that we're kind of mentoring to help kind of set their foundation if it's something they're interested in. But yeah, lots of good things going on.
Doc, I'm glad you're here. And again, I have a cat. I don't have a dog. Although I remember my days with my dog in particular. Cats don't eat normal human food. Like, they just won't. They just like, no.
They don't care to eat
I'm above
food?
that. That's
Okay,
what they say.
they're too good for
but
it.
dogs will pretty much eat anything you put in front of them. I did want to bring up a topic with you today. We want to build relationships and have relationships with our pets, and we're tempted from time to time to feed them human food. How devastating is that to the internals of a dog when you feed them regular human food?
So I do think that there is this kind of paradigm in the world that feeding your dog human food is like the worst thing ever. And I'll be the first to say it's not. It's not terrible. If you want to feed your dog some human food, feed it lean. And so, like, I mean, if you look to the ingredients of dog food, like things like lean chicken, lean hamburger, a lean piece of steak, those kind of things can be perfectly fine. I oftentimes will, like, if a dog's looking to weight loss or something like that, like green beans, carrots, something that's just chock full of fiber, right?
Mm-hmm.
Kind of a filler that's going to help make them feel full. But yeah, if you keep it lean, where people get into real trouble, I mean, obviously there's a number of different things that are toxic that we know of, like grapes, raisin, and chocolate, and those kind of things to steer away from. But if you keep it lean, the biggest place that will fall into trouble is like if a dog's been not eating any human food and suddenly they get like the fatty part of a steak. It can cause a condition called pancreatitis, where their pancreas gets real inflamed. But extra super fatty things, and that tends to be the stuff that we throw out, right? Like if you're eating a steak, I was eating a New York strip over the weekend. Cut that piece of fat off, and I'm looking at it, I'm like, I'm not giving that to Matt, not my dog. But I grew up in a household where my dad definitely would. My dad was throwing out all sorts of stuff to our dogs.
Here, y'all fight over
Or
it.
just putting all the leftovers in the dog's bowl. Yeah. that's the house I
for
grew
sure.
up in.
Yeah, me too. Yeah.
I think about peanut butter as one of the other ones. Any issue with peanut butter? I mean, I remember we would, by the end, because like when the dogs come in the end of their life, like, you hate me as a person if you want to, but I'm trying to just let my dog live the life they want to in the last few months. Just
give
stick
them the
it,
jar.
just go for it, bud. Just stick the whole tongue in there, man.
Yeah, no. And I think that, I mean, veterinarians, we love pets too, right? And especially, there's even like areas of vet med that are considered hospice now. You brought up, like, as pets come into the end of their life, and they're veterinary practices, they're specializing in hospice. And it's something that we do have folks we could talk to people about hospice type care for pets. Particularly going back to peanut butter. I would encourage, if you're going to do peanut butter, just double check that ingredient list, because for some reason, about 4 or 5 years ago, around COVID time, peanut butter companies started putting an ingredient called xylitol in their peanut butter, and it's an artificial sweetener. It's really common in chewing gum, and xylitol is toxic to dogs. It'll make their blood sugar drop. And so if you're going to give peanut butter, just double check that ingredients, or if you just stick with Jif, like just stick with a normal peanut butter that you've had in your house your whole life, you'll be in good shape.
Okay.
My dog loves carrots. That's like her favorite snack. Yeah. So yeah, she needed to lose a little weight, and so we just switched her from the little dog treats to baby carrots.
Here's your treats.
She's just as happy. She doesn't seem too upset about it.
Dr. Andrew Pierce, Dry Pond Animal Hospital and Pet Resort. You've got the option of both. You can have a wonderful veterinary service, take care of your pet. New flea and tick treatment potentially here, once a year injection.
You got it.
All right,
One
there it
shot.
is. That,
Very
that's
cool.
that was an official medical
There you go.
definition of what that is. There, drypondanimal.com. Check them out. Conveniently located in Denver, top-notch service, veterinary services, pet resort, and just great relationships. So you know that everything's okay with your pet. You just want somebody who cares and wants to take care of them and loves them like you do. Thanks,
You got
Dr.
it.
Andrew.
Thank
You got it.